cattle worker. It suits me down to the ground to get out in the yards and help out. I actually chose agribusiness, or even before that being a Jillaroo, but there was a fair bit of guidance in giving physio a try. I bought this house, designed a little practice underneath the house, had some friendly builders, and the day you didn't have to do too much planning, and raised the house and built it in underneath and had the kids upstairs and worked underneath.
What could you ask about your animal?
Maybe does it go woof woof? Yes.
Started off just gingerly stepping into multidisciplinary work. Added a podiatrist, came and joined, and a massage therapist in 2000 and 2001. And then in 2004 and 5 we also had a speech pathologist, exercise physiologist and dietitian.
What's this one?
So it started with my family. Now we're a big vital health family. There's many families of the communities represented in the staff.
Perfect. And then you can grab hold of the walker.
We all get to network together and help collaborate and treat some of the rural communities. So I think it's Vital Health is doing something great here in terms of supporting some of the smaller towns that need it.
Rome is a base for us because that's where we started. We reach out to Charleville, down to Cunnamulla, and then St George, to the east of here, Kingaroy, and then Dalby, Tara, and in northern New South Wales there's another little team down there as well.
Drive out to Morven, which is about 2 hours west of Roma, and we stop and see a couple of clients, and then we keep going to Charleville.
I think it really makes you think on your feet, and you've got to be adaptable. If you're out on outreach and you forget something you need, you can't drive 2 hours to go get it, you've just got to go on without it. It only takes one person to be like, oh, I'm seeing change in my daughter, or, I'm seeing those improvements, and it's really a rewarding experience, and it makes all the hard work worth it, I'd say.
You get this sense of reward, professional reward, but it's also challenging, and I'm quick to tell people that we have to support each other to rise to the challenge, because if you really want to make a difference, and there is so much variety, we have to accept that there's challenge in that as well. The first 20 years was I and others were going around thinking, oh my goodness, there's a gap there, that's really a big need, and then trying to engage people to value what was possible for them, and then go ahead and do that. Well, then the last 10 years has been the opposite. They're saying we need, we want, why can't we? How should we? What are the possibilities here? And then we run around and come up with some options to marry their requests. It's just a flip of the coin, and that's maturing and moving faster and faster.
The other thing, you have to pay for water as well.
Mm-hmm. It's really good, especially in the NDIS space. We get a lot of feedback that we're, changing people's lives. The NDIS is a relatively new disability framework, and being able to kind of see the real life differences that you make for these people is really important. And the community feels it as well.
So is it the diagnostic process or the NDIS process?
Both.
Okay.
We're always searching for how to marry technology to give us some improvements. Big innovations going on at the moment. One is the introduction of allied health assistants, in a really purposeful way, so that they complement what the allied health providers are doing, the registered providers. And then if we add telehealth to that, then we're really plumping up, so to speak, the extent of the services that we can pop into these really tiny towns. I'm really excited about the future of vital health, because I'm looking at lots of young people who have their careers and professions started in rural areas, and a lot of belonging an intent for them to contribute to the community. The communities are embracing them. I've got 5 grandchildren, and when I look at the little ones, I'm sure that some of them will be involved in rural professions, even if not in vital health. And I'll sit back and probably have my feet up at Pinaroo and watch what happens.